Hi, I'm Dr. Sukhpreet Kaur, working as a consultant pediatrician and neonatologist at Cloud9 Hospital, Ludhiana. After the baby is born and how much the baby should take breastfeed, is it adequate or not? There is no direct measure to it, but indirectly, definitely we can measure. So we can measure it from the urine output. So it is normally said that on the first day, baby should pass at least once in 24 hours. And on the second day, the urine output should be at least twice in 24 hours. And on day 3, it should be like at least minimum for 3 times in 24 hours. And fourth day onward, it should be like at least for the 5 to 6 times in 24 hours. And along with that, if there is adequate weight gain is there, so that means the feeding is adequate. So now what will be there that if the poor feeding is there, so your urine output will go low, and along with that weight gain will not be there in the baby. So ideally the birth weight should be gained by 10 to 14 days in babies, like it is slightly longer than on 14 days in the preterm babies, and it is achieved on the day 10 in a term baby. Along with that, if the poor feeding is there, the baby can land up with jaundice along with the fever, and that fever is not because of the infection, but it is because of the dehydration in a baby because of the poor feeding. Along with that, the seizures can happen. Baby can feel jitteriness. Along with that, the hypoglycemia part can also be there in the baby if the baby is having the poor feeding. And in some cases, the baby can also present the mother's complaint that there are blood in the urine, but in general it is not the blood, but it is the red spots on the diaper because of the urate crystals, and it happens in the dehydration if the poor feeding is there. And again, dark color urine can also be there because of this, and in the end, if we are not intervening at this point, the baby can be lethargic and can come up with the seizures also.